Hi, Dr. Jan Nursementor here. Nurses, if you never watch another video I post, watch this one to the very end. These 5 things could save your nursing career. Don't bypass technology. I often find the patient's armband or medication hasn't been scanned, or medications have been overridden from the dispensing machine using the override function. I've sat across from nurses who have made medication errors because they bypassed the med administration process. The most common reason for bypassing the process is that the barcodes won't scan. Some of these errors have caused patient harm. Overriding medications should only be done in an emergency. If you use override, make sure to follow the 7 rights with another nurse. My advice is to contact the pharmacy to have them recreate another barcode label or reprint the patient's armband and document the late administration due to a damaged barcode. When you bypass patient safety technology, you are risking your hard-earned nursing license. Always report critical values. Reporting critical values to the provider is critical to patient safety. A critical value is a potentially life-threatening result that needs urgent reporting to a medical provider so that treatment can be started. Nurse-to-provider reporting must be within 60 minutes of receiving the call from the lab, and document the call in the medical record per the hospital's policy. One common reason I've heard for no documentation is the provider was present at the bedside when the value was received. You must still document that you have reported the critical value to the provider. Documenting is the only way to close the communication loop and to verify you followed policy. Don't document the verbal telephone order readback and verify it if you have not spoken with the provider. Nurses are authorized to take verbal and telephone orders from a provider and transcribe the order into the system. The rule is that you must document the verbal telephone order, confirming that you have received the telephone order, read it back and verified it with the provider. The provider must sign off the order within 24 hours. Nurses administering medications without a provider's order are practicing outside of their nursing scope of practice. This may result in errors and adverse patient outcomes. Practicing outside of your nursing scope of practice is reportable to the Board of Nursing and may result in disciplinary action, your license being revoked, criminal charges, or litigation. Don't just check the box, write a note. Documenting by exception means you don't have to write additional notes when the patient is following their normal plan of care. When the patient deviates from the plan of care, it is important to write a nurse's note and the action taken. Some nurses have told me that they are concerned about writing a note because of the technology like MyChart, where patients can access their medical record in real time. The rule here is to write a factual note about what happened and the actions taken in a non-judgmental way. For example, during the night, infant found co-sleeping with mom, safe sleep education reinforced, infant placed back in the bassinet. Document in real time. If it's not documented, you didn't do it. I've seen nurses documenting 12 hours of care at the end of their shift and Q4 vitals and shift assessments performed earlier. Why is documenting in real time important? The healthcare team depends on accurate and timely documentation to make patient care decisions. Later absent documentation delays clinical decision-making and may cause a patient's safety issue when the important facts are not available to the care team. When you document late, you may be responsible for a patient not receiving the care they need in a timely manner. Make sure to protect yourselves so that you can speak to the care that you gave. Document by exception and write a nurse's note about any deviations from the plan of care. When documentation is missing from the medical record, it is difficult to explain the care you gave years from now when you receive that deposition letter from an attorney's office. If you want to see more videos like this, click like, subscribe, comment and share, and I'll see you soon.